Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, the Honorable of Miss Ratu Sarah Pujasari as an English lecturer and everyone who watched this video. Before we begin our presentation, let me introduce my group. We are from Group 2. Okay, for the next introduction of each member of Group 2, and I am Nur'aeni with NPM 22 41010 and 4 and 7 is a moderator. And next.
Thank you, Mala, but first let me introduce myself. My name is Anindya Rahmadhani with NPM 224101145.
Hello, let me introduce myself. My name is Alzena Kevina Shahla and my NPM is 224101086.
Hello, introduction. My name is Anuy Nurofiat with my NPM 224101243 as the second presenter.
Hello everyone, my name is Azmi Setiabudi. I am class B and my NPM is 089. I will be presenting about subfield in public health science.
Okay, thank you for my friends. And for the next, the presentation from our team. And today, the topic of our presentation is what is public health. And let's move to the first presentation that will be delivered by Adis. Okay, Adis, please.
Thank you, Mala. Definition of public health. Let's begin with what is public health. Public health is defined as science and art, which means applying science, art, or knowledge to enhance people's quality of life through enhancing their health and welfare. Public health is the science of protecting and improving the health of communities through education, the promotion of healthy lifestyles, and research for disease and injury prevention. There are three levels of prevention. The first, health promotion and specific protection, and the second, early detection and prompt treatment, and the last, rehabilitation and disability limitation. Overall, public health is concerned with protecting the health of entire populations. Now, let's move on to the next material that will be explained by my friends.
Well, thanks to Adis who has explained the next material, I will explain several factors. The number one is the environment. Environmental health is essentially a condition optimum environment so that it has a positive effect on the realization of status optimum health as well. Noto Atmojo in Riki 2005. Meanwhile, health environment, according to WHO, is a science and skill that focus attention to efforts to control the factor that exist in the physical environment. Human beings, WHO, are expected to cause or will cause things that are harmful physical the development, health, and survival. Environmental health covers very broad aspect covering almost all aspect of human life. The second is behavior. Health behavior is a person response to stimuli related to illness and disease. The healthcare system, food and environment according to Noto Atmojo in Dwi 2010. Stimuli associated with behavior health consists of four elements, namely illness and disease, the healthcare system, food and environment. The third is health service. Health service are any efforts that are carried out individually or jointly together in an organization to maintain and improve health, preventing and curing disease, as well as restoring personal health, family group, or of our community. A person's need for health service is objective because it is a manifestation of the health problems that exist in the community relevant in the pattern of disease. Thus, to determine a development of the need for health service can refer to development of disease patterns in society. And the last number 4 is genetic. Genetic factor affect only 5% of health status. Genetics usually associated with the resemblance of children to their parents in terms of body shape, body proportion, and acceleration of development. It is assumed that beside the real activity of the environment that determines growth, the similarity reflects the influence of genes contributed by parent up to offspring biological natural 1998. This factor has the less effect on individual health or society compared to other factors. The effect in health status individually occurs evolutionary and is the most difficult to detect. For that, it needs to be diagnostic counseling. Okay, next presenter with Azmi.
Thank you for Anuy. The next is subfield of public health science. Public health science has subfield. Among them, there's epidemiology. Epidemiology is study and analysis of the distribution, pattern, and determination of health and disease and condition in defined population. Health promotion is a behavioral social science that draws from biological, environment, psychological, physical, and medical science to promote health. And then the three is biostatistics. Biostatistics is statistical method to conduct research in area of biology. And then there's environmental health. Environmental health is study about all aspects of all natural and built environment. And then there's maternal and child health. Focus on health issues concerning women, child, and family, such as child care, maternal and child mental health, child immunization, and child nutrition. The sixth is nutrition. Nutrition is a study of nutrients in food and how the body uses them. Also, the relationship between diet, health, and disease. The next is occupational safety and health. Occupational safety and health is study about health and safety in the workplace. And then the last one is public health policy, defined as a law, regulation, action, and decision implemented within society in order to promote wellness. There's also a job for public health graduate. Among them, there's epidemiologist, health and safety officer, and then nutritionist, health visitor, and counselor. Thank you. The next will be presented by Alzena.
Okay, next I will explain about the functions of public health. So, there are main functions of public health, and the first one is assessment. It is to monitor health status, to identify public health problems, diagnose and investigate health problems and health hazards in public, and also evaluate the effectiveness, accessibility, and quality of private health services and population-based. The second is assurance. It is to connecting people with needed personal healthcare services and ensuring the provision of healthcare where it is not available. Ensure adequate public health and private healthcare competent, inform, educate, and empower people about health issues, and also mobilize community partnerships to identify and solve health problems. And the last one, or the third, is policy development. It is to develop policies and plans that support health efforts, individuals and communities, enforce laws and regulations that protect and ensure health safety, and also research for new insights and innovative solutions to health problems. Next, I will return to the moderator.
Okay, thank you for the presenter and thank you all for listening to our presentation today. But before I close this presentation, let me to give a conclusion. The conclusion is, with knowledge of public health, it's hope that people will care about themselves and their environment so that they can improve their health status, where the degree of public health can be influenced by four factors, namely the environment, behavior, health service, and genetics. Okay, thank you for attention guys. Wassalamualaikum warahmatullahi wabarakatuh.